Good afternoon, and thank you to this committee. My name is Thea Monyeé, and I am honored to speak as a representative of the Health Equity Policy Group. This group is a cohort of Black female health, mental health, research, biomedical, legal, substance use, behavioral, and community engagement strategists. Our focus is to address health inequities and disparities in Black America. Thank you for all the work and expressed intentions shared here today. It is exciting to hear. Mental health in America can be used as a mirror to reflect who we are as a society and what we value. The Black community's conflict with America's mental health system is not solely due to stigma or faith-centered beliefs and practices. It is due to righteous suspicion. The American mental health system is designed from a Eurocentric model and value system focused on the individual rather than an Afrocentric system of integration where everything is connected. So what is the challenge? The current mental health model is designed at best to teach Black bodies to cope with systemic oppression, violence, and inequity, while simultaneously educating and training practitioners to believe they are incapable of harboring bias or being a tool of a systemic racism system. One example is how providers of color are scarce and are trained within a system centering white clients and their cultural norms. Another is how practitioners are discouraged from implementing culturally relevant healing practices unless they are sanctioned and deemed acceptable by white leaders in the mental health field. Some of the solutions could be creating mental health resources and models that understand that Black communities thrive in spaces that center their cultural values, including creativity, community, and spirituality. We deserve to see our community members and values integrated into this current model. The mental health field must shift from neutrality to directly addressing systemic oppression in and out of the therapy room in order to meet this standard. We recommend mental health professional associations and governing bodies seek, attract, and retain diverse cultures, perspectives, and beliefs to create and implement culturally and socially equitable guidelines, ethics, policies, education, standards, assessment tools, and treatment that are created for and by us. We must make joy the baseline standard for all areas of health when engaging with Black communities. Create a modifier for racism within the DSM, naming it as undoubtedly the most stressful environmental factor Black America is facing. In closing, the current individualistic model of mental health fails to acknowledge the impact of systemic racism on Black bodies, which includes micro-invalidation, microaggression, and micro-inequities. We cannot equitably address the mental health needs of Black people in America unless we begin by valuing them in all areas of society and acknowledging that the #1 problem Black communities face in America, including in mental health, is white supremacy. Thank you so much for this opportunity.